Dr. Mehmet Oz, the former television personality and newly appointed head of the Centers for Medicare and Medicaid Services, CMS, has sparked controversy with his first all-staff address. His appointment, confirmed by the Senate despite significant criticism, places him at the helm of an agency managing a staggering $1.5 trillion annual budget and impacting the healthcare of nearly half the American population. This appointment comes at a turbulent time for the Federal Department of Health and Human Services, HHS, facing a planned 25% workforce reduction under Secretary Robert F. Kennedy, Jr., and the influence of Elon Musk's informal Department of Government Efficiency. Oz's address, according to sources who spoke to Wired magazine, focused on the potential of artificial intelligence, AI, in healthcare. He reportedly presented a stark comparison: a $100 per hour consultation with a human physician versus a $2 per hour AI-driven interaction for a diabetes diagnosis. He further suggested that patients might even prefer the impersonal efficiency of an AI avatar. This assertion, alongside his call for staff to maintain a patriotic duty to remain healthy, has raised significant eyebrows within the agency and across the broader healthcare community. The implications of Oz's vision are far-reaching. CMS oversees a complex web of regulations governing America's health insurance system, and its decisions profoundly impact access to care for millions. The agency's recent relatively minor workforce, employees out of a projected 20,000 HHS-wide cuts, fully reflect the potential ramifications of these sweeping changes. The proposed cuts, particularly targeting Medicaid, the health insurance program for low-income individuals covering roughly 71 million Americans, are especially contentious. Republican lawmakers are pushing for these reductions to fund tax cuts primarily benefiting the wealthy, further fueling anxieties about healthcare accessibility and affordability. Dr. Oz's background is as complex as the challenges facing CMS. Before his foray into television and politics, he was a practicing surgeon. His long-running show, The Dr. Oz Show, a spin-off of Oprah Winfrey's successful program, catapulted him to national prominence. However, this fame was also accompanied by consistent criticism. His endorsement of various unproven remedies, including magic, weight loss supplements, and the controversial use of hydroxychloroquine for COVID-19 treatment, significantly tarnished his reputation among many healthcare professionals and the public. His subsequent unsuccessful bid for a Pennsylvania Senate seat further highlighted the complexities of his career trajectory. Now, at the helm of CMS, Oz faces the formidable task of navigating a deeply divided political landscape and addressing crucial healthcare challenges. His controversial statements regarding AI and his past history of promoting unproven treatments raise significant questions about his leadership style and decision-making capabilities. The future of CMS, and by extension, the healthcare system for millions of Americans, hangs precariously in the balance under his stewardship. This appointment, far from a quiet transition, has ignited a national conversation about healthcare reform, the role of technology in medicine, and the potential consequences of political appointments within critical government agencies. The coming months will undoubtedly reveal much about Dr. Oz's leadership and the direction of CMS under his command. The weight of responsibility on his shoulders and the impact on the lives of millions is undeniable. The question remains: will he rise to the challenge, or will his controversial past overshadow his future actions?